order to breathe, we're talking about inhalation and exhalation, the size of the thoracic cavity must change simply because by changing the size of the lungs, the pressure inside the lungs is going to be different. And we need that pressure difference, that pressure gradient between the pressure of air inside the lungs versus the pressure of air in the atmosphere, because air always moves from high to low pressure. The change in the size and volume of the lungs would be due to the contraction of some skeletal muscles. Skeletal muscles contract when they receive nerve impulses from brain. We do not consciously think about our breathing. There are sections of brain that they control our breathing. When we have a normal quiet breathing, we breathe about 12 times in 1 minute. One normal inhalation and exhalation would be about 5 seconds. But it's important to note that a normal quiet inhalation takes only about 2 seconds. A normal quiet exhalation takes about 3 seconds. Here we have a mid-sagittal view of the brain. First, we focus on the medulla oblongata. We know medulla oblongata is the most inferior part of brainstem. That's the one that is fused to the spinal cord. In medulla oblongata, we have some groups of neurons that we refer to all of them as medullary respiratory center. When we focus on the neurons that are located in the anterior section, where I'm pointing at, we name these neurons ventral respiratory group. The neurons that are located slightly posteriorly, we call them dorsal respiratory group. So we have dorsal respiratory group and ventral respiratory group together would be referred to as medullary respiratory center. These are the neurons that in this video we're going to talk about and see how they control our breathing. Please note in pons, we do have another group that we refer to them as pontine respiratory group. Pontine respiratory group would be in close communication with the medullary respiratory center in medulla oblongata to basically change our breathing pattern. If we want to have a normal inhalation, the one that takes only 2 seconds, we see that the neurons that we have in dorsal respiratory group start firing signal, but the nerve impulses that they generate first is weak, and gradually those nerve impulses strengthen and they send these signals for 2 seconds continuously to the muscles that we need to contract in order to have a normal quiet inhalation. So imagine from dorsal respiratory group, nerve impulses are sent down. Diaphragm is one of the muscles that receive these signals, and we know that diaphragm, when it contracts, start moving down. In a normal quiet inhalation, when nerve impulses from dorsal respiratory group stimulate diaphragm, we see that diaphragm descends, moves down about 1 centimeter and increases the vertical diameter of the lungs. Basically, diaphragm is pulling the lungs down. By increasing the vertical diameter of the two lungs about 1 to 3 millimeter of mercury, pressure of air inside the lungs would drop. So basically we just create a pressure difference between lungs and atmosphere. From atmosphere, air can easily diffuse into the lungs. In a normal quiet inhalation, usually that 1 centimeter movement of diaphragm down and decreasing the pressure, intra-alveolar pressure, about 1 to 3 millimeter of mercury, is sufficient for diffusion of about 500 milliliter of air. However, if we have a forceful labored inhalation, let's say you're exercising, that would be the moment that your diaphragm can actually contract and move down about 10 centimeters. And that can decrease the pressure inside the lungs for about 100 millimeter of mercury. When we create such a significant difference in the pressure inside the lungs versus atmosphere, that allows 2 to 3 liters of air to diffuse into the lungs. Diaphragm is one of the major inhalatory, or we can say inspiratory muscles that we have. In a normal quiet inhalation, that contraction of diaphragm for about 1 centimeter is responsible for about 75% of the volume of air that goes inside the lungs. Why this is so important? Anything that disrupts movement of diaphragm down can significantly impact how much air can diffuse inside the lung. So if you think about it, when diaphragm moves down, it presses the abdominal cavity. If we're dealing with someone who is very obese, or during pregnancy, or any condition that does not allow movement of diaphragm easily down impact the volume of air that we receive inside the lungs. From dorsal respiratory group, we send signals out of the central nervous system to reach diaphragm through nerves that we call them phrenic nerves. Phrenic nerves exit the central nervous system at the level of C3, C4, and C5 when we're talking about the vertebral column and spinal cord. So when we think about the location of phrenic nerve, we are referring to the cervical region. That is one of the other reasons that protecting the cervical region is extremely important. So if we have the habit of cracking our neck, we have to rethink about those sudden movements. And I'm sure that you know, when transferring patients, especially patients of trauma, to the hospital, the neck has to be stabilized. Now, back to the dorsal respiratory group, we clarified that this group for 2 seconds sends signal to the diaphragm through phrenic nerves, and also they send signal to external intercostal muscles. Please keep in mind, between ribs and costal cartilages, we find 2 groups of intercostal muscles. The external intercostal muscles are the ones that are more superficially located. When these muscles contract, they pull the thoracic cavity, including the lungs, laterally, also anteriorly and posteriorly. So in short, we say that contraction of external intercostal muscles, and they are stimulated by dorsal respiratory group, would lead to an increasing the diameter of the lungs anteroposteriorly and laterally. And contraction of external intercostal muscles in a quiet normal inhalation would be responsible for 25% of the volume of air that goes inside the lungs. So dorsal respiratory group for 2 seconds keeps sending signal to diaphragm and external intercostal muscles, which we refer to them as main inhalatory muscles. After the 2 seconds, dorsal respiratory group, the neurons here all together become inactive. Basically, they stop sending signal. When they stop sending signal, diaphragm and external intercostal muscles have the opportunity to relax. And we know that muscles have elasticity. They tend to go back to their original length, size, shape, location. So as you can see, diaphragm relaxes and becomes that dome-shaped muscle that we see here. And external intercostal muscles, when they relax, obviously the size of the thoracic cavity goes back to a smaller size. And we know, following Boyle's law, when the volume of the lungs decreases, pressure builds up inside the lungs. So now we create a higher pressure inside the lungs, which allow air during a normal exhalation to diffuse out of the lungs into the atmosphere. During the normal inhalation, dorsal respiratory group sends signal to external intercostal muscles through intercostal nerves, and specifically those intercostal nerves exit the spinal cord at the level of T2 to T12. Recall, when it comes to phrenic nerves, we find the fibers that form phrenic nerves in C3, C4, and C5. So trauma to this section or trauma to thoracic section could easily impact ability to breathe. And obviously, during a normal exhalation, the dorsal respiratory group becomes inactive and stops sending signal through phrenic nerves to the diaphragm and through the nerves T2 to T12 to external intercostal muscles. When we analyze the ventral respiratory group, there are some neurons in ventral respiratory group that we refer to them as Pre-Bötzinger. Researchers show that Pre-Bötzinger group contains some pacemaker cells. We don't know the mechanism, but we know that they are in close communication with dorsal respiratory group to set the rhythm and the rate of breathing. To have a forceful breathing, for example, let's say you're exercising, first let's consider that a forceful labored inhalation takes more than 2 seconds, and a forceful labored exhalation is going to be longer than 3 seconds. To have a forceful labored inhalation, the dorsal respiratory group is going to send more number of nerve impulses for more than 2 seconds to diaphragm and external intercostal muscles. When muscles receive more number of signals, they're going to contract more forcefully. Also, dorsal respiratory group, aside from stimulating the main inhalatory muscles, stimulate stimulate a section of ventral respiratory group. This section of ventral respiratory group is involved in forceful inhalation. This part of ventral respiratory group is going to fire signal to muscles that we refer to them as accessory muscles of inhalation. Those muscles include sternocleidomastoid muscles. In this model, we can see the right one, scalene muscles, and pectoralis minor muscles. When sternocleidomastoid muscles contract, they elevate sternum. Scalene muscles are capable of elevating ribs 1 and 2, and pectoralis minor muscles elevate ribs 3, 4, and 5. So when that section of ventral respiratory group stimulates sternocleidomastoid muscles, scalene muscles, and pectoralis minor muscles, sternum and ribs 1 to 5 all will be elevated, and that helps increasing the volume of thoracic cavity, including the lungs. So ventral respiratory group is going to stimulate the accessory muscles of inhalation, and as a result, the pressure decreases inside the lungs and air diffuses from atmosphere into the lungs. Ventral respiratory group sends signal to sternocleidomastoid muscles through cranial nerve number 11, which would be accessory nerves, and spinal nerves C2 and C3. That section of ventral respiratory group sends signal to pectoralis minor muscles through nerves that exit the spinal cord at the level of C8 and T1, and to stimulate scalene muscles, cervical nerves are used. When we are done with a forceful labored inhalation, it's time to have a forceful labored exhalation. So that will be the moment that dorsal respiratory group becomes inactive. It stops sending signal to diaphragm and external intercostal muscles. Also, that section of ventral respiratory group that is involved in forceful inhalation becomes inactive. It stops sending signal to accessory muscles of inhalation. So all these muscles are going to relax. Clearly, that's the moment that elastic recoil helps decreasing the volume of the thoracic cavity, which helps increasing the pressure inside the lungs to allow air to diffuse out. However, we notice that during a forceful exhalation, another section of ventral respiratory group that is involved in forceful exhalation start firing signal to exhalatory muscles. Exhalatory muscles include internal intercostal muscles, which when they contract, they push the rib cage back in to decrease the volume of the thoracic cavity, and abdominal muscles. When we say abdominal muscles, we mean rectus abdominis, external abdominal oblique, internal abdominal oblique, and transversus abdominis. So when these abdominal muscles contract, they push the abdominal wall back in, so pressure builds up inside the abdominal cavity, which pushes the diaphragm up. And when diaphragm is pushed up, obviously the vertical diameter of the thoracic cavity, including the lungs, would decrease. So that helps increasing the pressure inside the lungs to allow air to diffuse out. This section of ventral respiratory group sends signal to internal intercostal muscles through intercostal nerves that exit the spinal cord at the level of T2 to T12, and it sends signal to these 4 groups of abdominal muscles through spinal nerves T7 to L1. So those are the pathways that this section of ventral respiratory group uses to communicate and stimulate the exhalatory muscle. Now that we have learned how respiratory center controls our breathing, let's acknowledge that depending on the input that the respiratory center receives from different body parts, it alters breathing pattern. For example, from cerebral cortex, we have connections to the respiratory center. That simply means that we can think and decide and consciously change our breathing pattern. For example, we can voluntarily stop breathing for a short period of time to protect ourselves. Let's say you are in a place that there is a toxic gas or there is an unpleasant odor. However, when we hold our breath, we end up with the buildup of carbon dioxide and hydrogen ion in our body, including in blood and cerebrospinal fluid. When chemoreceptors detect that pressure of carbon dioxide has increased, the concentration of hydrogen ion has increased, they quickly send input to the dorsal respiratory group. The dorsal respiratory respiratory group becomes strongly stimulated and starts the breathing process. Basically, we are forced to start breathing again. That's why I emphasize that we can hold our breath consciously, but that would be for a short period of time. Also, from proprioceptors, we receive input in the respiratory center. Recall that proprioceptors are those receptors that we have, for example, in our joint capsules, skeletal muscles, tendons, ligaments. Basically, they detect your physical activity. So when you are physically active, let's say you do some aerobic exercises, clearly those signals will be sent. Again, the target is dorsal respiratory group, and dorsal respiratory group becomes highly active and changes our breathing from quiet normal to forceful labor, which that's what we need during a fight or flight situation such as exercising. Also from hypothalamus, recall hypothalamus is this small section of the brain, and limbic system, we have connection to the respiratory center. So our emotion can easily alter our breathing. For example, when you are crying, when you are laughing really hard at your friend's joke, or when you're acting. So emotion also can be a factor here. These are just a few examples that we do not need to consciously keep thinking about our breathing. The breathing pattern depends on the input that respiratory center receives from different body parts and different receptors that we have. I hope you find this helpful.